January 1. Joining us now is Tim Young, the CEO of Summit Medical Group, to talk about, of course, the impact on doctors, patients, and let's face it, healthcare in general. Tim, it's good to see you.
Good to see you.
Thanks for being here.
Yeah.
Give us a sense of where it stands right now with Congress.
On Tuesday, the House of Representatives passed a bill that included what is commonly referred to as the doc fix. This is something that we've been dealing with each year for the last decade, actually. And the House has passed a bill. It is expected that the Senate would meet next week and would take up this bill. However, there are a number of controversial issues that are also contained within this proposed piece of legislation that reportedly we're hearing that it's dead on arrival at the Senate.
Okay.
So unfortunately, we're not optimistic about a fix before the end of the year, which obviously results in a number of different issues and concerns that we have for what that will mean.
Let's talk about it specific to each group. What
Sure.
does this mean then for doctors?
For doctors, there are a number of issues. Probably the most pronounced one for physicians would be the economic impact and what resulting operational adjustments that they would have to make to their practices in the event that they have to sustain this kind of a fee schedule cut. We all are familiar with increase in inflation and costs that we incur each year for labor and for consumables. Imagine, if you would, a 27% reduction in what is as large for many of physician practices as 50% of their practice.
That's substantial.
It's huge, and so not any physician group would be unaffected by this. There have been a number of professional organizations that each year conduct surveys as to what in fact would occur should the cuts go through. Those include such things as a reduction in staff, a significant restriction on patient access. This is the bigger issue for patients, obviously, but that's a big impact for physicians as well. They very much value their relationships with their patients, and so jeopardizing that physician-patient relationship is really the root issue here that is at stake.
Let's talk more about the patients then.
Okay.
Obviously you touched on that, but what Medicare patients then? How does this impact them?
A number of practices, depending on how significant Medicare represents of their total patient population, there are scales of responses for some groups. For our group, for example, about 40% of all the all the patients that we care for are Medicare. And so those patients would probably, would suffer from restricted access. Either some physicians about a third of the nation's physicians presently do not accept new Medicare patients because of this constant year-end struggle that we've had with the unsustainability of the present physician fee schedule. What would undoubtedly happen is that would become worse. Some patients might have limited access to specialists, or some physicians may choose to get out of the Medicare program entirely, which again, in certain specialties, we already have a shortage of physicians. That would only exacerbate an access issue for patients across the country. No doubt this is
Potentially it has a huge impact on a lot of people. In our final seconds then, what should people do? Is there anything they can do to have their voices heard?
At this point, they should certainly contact their senators. The Senate will be taking up this bill next week. Contacting their senators is of importance in that they can show their need to support legislation that does in fact fix this on an ongoing basis. We need to find a long-term sustainable solution. This is, as you know, is a Band-Aid solution. It's a temporary fix. So they need to contact their senators in the interim. Should, however, that legislation fail, they will need to, there could be a need to contact their congressman as well, because they may be starting in January with a whole nother piece of legislation to address this issue.
So we're just going to have to wait to see how this plays out.
That's correct, unfortunately.
Yeah. Well, Tim, it's a pleasure. Thank you for explaining this to us, because
You're
it is
welcome.
rather complicated, but you explained it well.